Good morning and a very warm welcome to everyone from the insurance industry who's joining us to this Sparta event that we hope will help you to stay positive and reduce the anxiety you may be experiencing in these uncertain times. So to start with, a little bit about myself. I'm Dr. Sandi Mann. I'm a psychologist and a psychology lecturer. I teach applied clinical psychology at university. I also have a private clinic in Manchester specialising in anxiety conditions and depression as well. I've written around 20 books, psychology books, a lot of them self-help books, which you're welcome to Google after this session. And I'm clinical psychology lead for Sparta Health. So how this works today, we've got 30 minutes. I've got a lot of questions that you've already submitted, so many thanks to those. I'll be referring to some of these throughout this webinar. Feel free to comment as well in the chat box below or the chat pod. Those questions or comments will be moderated by our webinar team and they'll be passed on to me as and when appropriate. So there's two main themes for this session today: how to stay positive during these very uncertain, challenging times, and how to manage your anxiety. So I'm going to start with the anxiety first because it's always nice to end on a more positive note. So we'll end on how to stay positive towards the end of this session. So managing anxiety then. Well, there's lots to be anxious about right now, possibly even more to be anxious about now than there was at the start of all of this. Coming out of lockdown, we're approaching that now. Lots of worries about COVID, getting ill possibly, but also about making decisions about coming out of lockdown. I've had quite a few questions in from some of you about this. One example is this one. Recently, there's obviously a lot more news about how the country is going to start opening up. It feels like this is going to lead us into a whole new set of decisions that we're going to have to make and may lead to increased anxieties. So that's definitely true. Decision making, having to go back into the outside world after so long can be a real source of anxiety. So we'll talk a little bit about that. Anxiety about others not following social distancing, perhaps, whether they be your family or strangers. That can cause a lot of anxiety. And there's a question that somebody sent in. I have loved ones that are not taking things as seriously as we would want them to. How can I convince family and friends to continue to follow social distancing and anxiety around that? So that's obviously quite a big source of anxiety and could get worse as we move into different phases of this COVID situation. There's also the anxieties about coping with new ways of working. And in fact, that may increase. We've got used perhaps to working remotely, and now perhaps we're going to a different regime, a different arena where we may have a mix or different ways of working. So there's a lot of anxiety around that. The new technology that we're working with and the new learning and the informational overload, these are all sources of anxiety. There's a question about Zoom fatigue somebody sent. Dealing with remote working workout, any thoughts on Zoom fatigue? What is this about really? Well, I have lots of thoughts on that. I'll come back to that later. Information overload is a really big source of anxiety as well. And this has been constant throughout, and I don't think it's really going to change. Question on that. There's so much information online, on social media, etc. How do you recommend that people strike a balance between staying informed and overloading by the information out there? So that's something that we'll be addressing throughout this session as well. There may also be this idea of being afraid of people as well. So some people may actually experience that fear of going back into the outside world and working with people again. So let's start addressing some of these issues. Let me start by pointing out that there are actually some benefits to anxiety, and there are also some perceived benefits. So there are benefits. The benefits of anxiety include the idea that they can help you. Anxiety can help you find solutions. Anxiety is very good for problem solving. One of the really good things about anxiety is that it can make you take things more seriously. If we're not anxious about things, then we don't actually necessarily take action. So it can increase our motivation to get things done. If we're not anxious about COVID, Corona, we might not wash our hands. We might not take advice seriously. We might think everything's going to be okay when in fact we need to take that appropriate action. So anxiety can motivate us to take that action. It can also help us with problem solving, because if we're anxious about something, for example, getting to a meeting on time or something like that, it helps us to plan and make sure that we set off earlier and take action to make sure that we're going to address these issues. So anxiety can be a very beneficial thing as well as being something that is negative. And one of the reasons that it can be negative is to do with our beliefs about anxiety. And there are a lot of perceived benefits to anxiety as well as actual benefits. Some people have very positive, what we call positive beliefs about anxiety, in that they think that anxiety can be more useful than it actually is. For example, some people think that if I worry about something, it will help me cope better with negative outcomes in the future. Some people think that if I worry about something, it shows how responsible I am or what a good citizen I am. Sometimes people think that it can protect us by worrying. Perhaps by worrying, I'm actually going to stop that negative outcome happening in the future. So one of the first things we can do about worry is think about that anxiety and our beliefs about anxiety. Do you have very positive beliefs about anxiety? Do you think that anxiety is something that is very positive? If so, it might be worth challenging some of those beliefs. So, for example, does worrying really help you cope with possible negative outcomes? Can you think of an example where a negative outcome occurred and you were still distressed, even though you'd worried about it? Are there people that you know who don't worry so much, who are still responsible citizens? Can worry actually prevent things happening in the future? Probably not, because that's the kind of magical thinking, the idea that if I worry about something, I'm going to prevent it actually happening in the future. That suggests that there's a link between our thoughts and our feelings and the outcomes. Obviously, that's magical thinking. We can't influence what's going to happen in the future just by worrying about it. But some people deep down think they can. So the first step to managing anxiety is always going to be addressing that anxiety in terms of looking at your beliefs about anxiety and addressing those and challenging those beliefs about how useful you think that anxiety is. It's also worth looking at other unhelpful thinking styles that anxious people often adopt. So very anxious people do adopt these unhelpful thinking styles. So we've talked about the idea of magical thinking and positive beliefs about worry. But there's also other thinking styles. For example, very anxious people often overestimate threat whilst underestimating their own coping skills and coping strategies. So anxious people constantly imagine the worst. They think that the threat is much, much bigger than it actually is, whatever that threat is. And all those worries that we talked about at the beginning of this webinar, it doesn't really matter what the worries are, it's how we deal with them and how we deal with worry in general and anxiety in general that is the issue here. So overestimating the threat, whatever that is, whether that's threat of redundancy, threat of getting ill, threat of your family getting seriously ill, threat of not being able to cope, whatever it is, people who are anxious overestimate that, whilst at the same time underestimating their ability to cope. We can cope probably better than we think we can. And I speak to a lot of people who tell me, oh, if this happens, I'll fall to pieces, I won't be able to cope. But in reality, people do cope, people do manage in the main. And if not, there's help out there. I've had a lot of people come to me in my clinic, and actually one of the questions, or a couple of the questions that people have submitted for today have been about addressing things in my clinic and how I'm dealing with questions in my clinic. And a lot of people are saying in my clinic, well, I won't be able to cope if this happens, if that happens. And yet we find that even if you're struggling to cope, there's a lot of help out there. And that's actually one of the positives about the current situation we're in, how helpful people are, how much help is out there. I'll come on to that later when we're talking about positive elements of COVID. So other unhelpful thinking styles that very anxious people engage in: threat scanning, constantly looking for threat, constantly scanning your environment for threat. That could include constantly scanning your body for threat, perhaps symptoms of COVID. Am I ill? Could this be a symptom of COVID? Am I breathing properly? Have I got a tickle at the back of my throat? Constantly self-monitoring, being hypersensitive to those symptoms, but also constantly scanning news sites and information to try and get more information, to try and get some sense of control. And again, we'll come back to that later, but be aware if this is something that you do. Another unhelpful thinking style that anxious people often engage in is catastrophizing. This is where we immediately assume that the very worst is going to happen. I'm going to get ill, I'm going to die, my family's going to get ill, going to die, I'm going to lose my job. everything's going to be a disaster. We know things aren't great. We know that there are difficult situations out there, but that doesn't mean that it's going to be a catastrophe. And sometimes we just need a little bit of dose of reality there. So that's an unhelpful thinking style. Emotional reasoning is another unhelpful thinking style. This is where we feel something, so it must be true. I feel scared, so there must be a threat. But there isn't always that link between how we feel and the reality out there. And that's something that we really need to challenge and think about. Just because we feel afraid doesn't mean there's something genuine to be afraid of. A good example, when I work with people who are afraid of flying, they'll tell me things like, well, I feel that if I get on that plane, I feel it's going to crash. But they need to learn that that feeling doesn't mean that that's actually going to happen. It's just a feeling. There's no connection between how we feel and the reality. And along with that is this idea, this unhelpful thinking style of fortune telling, whereby we think we know what's going to happen in the future. We don't. And if there's one thing that we do know, is that we don't know what's going to happen in the future. So with all of these unhelpful thinking styles, the first step is challenging these thinking styles. Always redirect your attention to the facts. Use only trusted resources. So the information overload can be tackled by looking at appropriate websites like gov.uk, BBC News. Reduce your information diet. The next step to categorizing your worries is looking at them into categories of those that you can do something about and those that you can't. So the first step was challenging your beliefs about worry and anxiety. Now we're looking at separating out those anxieties and those worries into those that you can control, those that you can do something about, and those that you can't. Those that you have some control over, it's a really good idea to do a kind of mind map where you put your worry in the middle and little kind of spider diagrams or offshoots of possible solutions. And perhaps schedule worry time when you can address these and come up with possible solutions. And that's using worry in a positive way. Of course, there's lots of things that we can't control, and this is a really big source of distress for a lot of people. And this leads us on to managing uncertainty. Managing uncertainty is something that really maintains the worry cycle. So before we go on to that, let's try and focus on those things that we can control, even though the whole world seems out of control at the moment. So we can focus on things that we can do. We can build resilience, we can follow advice, we can limit our information diet, we can eat healthily, we can take vitamins and exercise to try and keep ourselves healthy. We can seek connections with others, even if we can't see them face to face. We obviously can't control other things. We can't control whether we're going to get ill. We can't control other people, and that includes whether other people are keeping a social distance from us or from our loved ones. We can't control all of those, but let's focus on those things that we can control for the moment. When it comes to thinking about those things we can't control, again, we're going into the arena of managing uncertainty. As I said, this is what maintains the worry cycle. When anxious people, or very anxious people, face uncertainty, which is what we're doing very much so now, they're more likely to see ambiguous situations as very threatening. And this means that they're more likely to look for information, or as much information as they possibly can in ambiguous situations before making decisions. And they feel less confident in this decision making. And all of this is very relevant now as we start to think about coming out of lockdown. When we're in an ambiguous situation, which we are, because we don't know what to do, nobody really knows what to do and what's safe, this can make us feel more anxious as we struggle to get control of that anxiety and that uncertainty. We can attempt to minimize this uncertainty by trying to increase certainty with reassurance seeking, information seeking, checking, repeating, planning. But at the end of the day, it's an impossible task because it is a very uncertain world and there's only so much we can do to increase our certainty. So all of these things that we do, all of these strategies to try and increase our certainty are all really doomed to failure because the only thing that we're really certain of at the moment is that everything is uncertain. So instead of trying to increase certainty, what we really need to be trying to do is to increase our tolerance for that uncomfortable feeling of uncertainty. The reality is that we can't be certain about anything. Even pre-COVID, before all this, we might have thought we were in a more certain world, but that was just an illusion. There's no such thing as certainty. We need to accept that uncertainty is the only thing that we're actually certain of. One way to do this, or to try to increase your tolerance for uncertainty, is to make a list of all the things pre-COVID that you couldn't control, that you thought you could, but you couldn't. Things that were uncertain. For example, you may be sitting here thinking, well, in the old days, I knew I could get in my car, go to work, get the tram, go to work or whatever. I knew I was going to come home at the end of the day. I knew I was going to have a meal, see my family. At the weekend, I had these plans. But really, there's nothing certain. It was an illusion of certainty. Uncertain things, sudden things happen to people all the time. But most of the time, we don't focus on that. The only thing that's changed now is that we're hypersensitive to uncertainty. We're much more hypersensitive about that. Everything was uncertain before, we just didn't realise it. We didn't focus on it. Most of us don't get into a car and every time think, oh my gosh, this car could crash. Will I actually get to my destination? We take for granted that we will. And yet, that's not certain. You've actually got more risk of being in a car accident than a plane accident, in a plane crash. But there are more people afraid of planes than there are of driving in a car or getting in a car. So it's all about illusions of certainty. And one way to tackle this is to really stop and think about all the things that you're not certain of, and to try to keep building up your tolerance for that uncomfortable feeling of uncertainty. Instead of trying to overcome that feeling of uncertainty, because it is very uncomfortable, try to build it up, try to constantly build that feeling or get feeling of uncertainty or tolerance for that uncomfortable feeling. So that brings us on to how to stay positive. This is something that is quite difficult in these very uncertain times. We've talked about how to challenge your worries, how to challenge your anxiety, how to cope with that feeling of uncertainty. But let's look on the more positive side and a brighter side and think about what is positive and how can we stay positive in these very difficult situations. One of the things that I think is really important, and the first step to staying positive, is to manage your expectations. I think there's a lot of stuff on social media and in the media about coping and about being resilient and about doing amazing things in lockdown and about great innovations. But we're all human, we're all struggling, we're all finding things difficult, and that's okay. You will struggle. And as things go forward and life changes and we adapt to a new normal, we will struggle. We will make mistakes as well. We will get things wrong, and that's okay because we're all human. So manage our expectations. And there was a question here that somebody sent, is it okay to be vulnerable during this time? Yes, it's okay. Not only is it okay, it's probably normal. And in fact, you might want to use that time to speak to other people. Ask them if they're feeling vulnerable or stressed, because most of us will be at some point, at different points, but at some point we'll all be experiencing these difficulties. That's very normal. So again, manage those expectations. Some people are going to be more adversely affected than others, depending on your situation, and that's okay too. You might look around and think everybody else is coping really well, and you're looking on social media and people are posting their photographs of all the amazing things they're doing during lockdown, or the amazing skills they're learning, and how they're managing to work and homeschool and look after people and shop and all at the same time. But we don't know what's going on behind the scenes. So don't assume that everybody else's life is perfect. It probably isn't. Most people at some point will probably be struggling just as much as you are. But there is a lot to be positive about as well. And I think it's a really good opportunity now to make a list. After this seminar, after this webinar, make a list of all those things that are good in your life at the moment. There's more there than we realise, a lot more there than we realise. And one of the things that I like to do at the end of each day is make a list of all the things that I'm grateful for, all the things that I've enjoyed, all the pleasure that you've had in the day. When this first started, when the pandemic first started and lockdown first started, I and a lot of my clients really struggled with that. And the things that we could write down at the end of the day as things we've enjoyed and things we're grateful for seemed quite minimal. And I remember people were saying things like, well, all there is maybe a hot bath at the end of the day, or a nice shower, or a coffee. But as we ease out of lockdown and as we get used to this situation, there is more and more out there that we can write down and we can notice, enjoy, appreciate, be grateful for, and be positive about if we just stopped to notice them. So things that we take for granted, let's stop and appreciate them. So we're allowed out for exercise now for unlimited amounts. Find somewhere to walk, find somewhere really nice to walk or run. Getting outside in nature is a really positive experience. And there's so much to appreciate out there. And if you don't live near greenery or parkland or a park, that's okay. There's a surprising amount to enjoy and to appreciate in our streets. I took a walk the other day through the streets to a supermarket. It was a long walk, about an hour there and an hour back, but I thought I'd combine my shopping with my exercise. And I noticed things that I'd never noticed before and I'd never really appreciated before. Beautiful architecture, really old buildings, allotments, all kinds of stuff. And I noted those and I enjoyed them. So there's lots to be positive about. There's also the enormous positivity that's coming out of our communities and the things that people are doing to help each other. A lot of people I speak to are doing good stuff for other people. There's food banks, there's shopping services, there's ringing people, friends or acquaintances, offering support. We can all do this with people that we work with. We can offer support to our colleagues and people we work with. Are you okay? How are you managing? I was speaking to a colleague the other day and they were kind of moaning and saying, everything's taking so much longer because every meeting I have with somebody at work, we have to start by asking how you're managing, how you're coping, and a whole discussion. And yes, things take longer, but that's really nice as well that we're getting that human connection. And what's really positive about this very difficult situation is that we can actually connect more than we used to. And I'm speaking to a lot of people who are telling me that they're getting more human interaction and more connection with people than they used to because they have time, because other people have time, and because there's so much more vulnerability out there and people are asking about it. So that's something really positive that you can do. Everybody can do something to help other people, even if you're very vulnerable, even if you're self-isolating, even if you can't do shopping or anything else for other people, you can still connect with them through phones, through the internet and stuff like that. So helping other people is something really positive that our communities are doing. The other thing that's really positive is that we're able to embrace this time if we can. We can enjoy the challenge of doing things differently. I find this really exciting. I personally am not a natural change embracer. I'm the sort of person that's the last person to get that new device and that new technology. I have to be forced into it. But I have been forced into change. I've been forced into doing things really differently. I'm a therapist, I'm a psychologist. All our work has always been face-to-face. Before lockdown, everybody said you can't do it by remote. It just won't work. It's not possible. Since lockdown, not only are we doing therapy remotely, not only is it working, but it's working really well. And I'm seeing people who are preferring it. They're finding it much better. They're in the comfort of their own home. They're more relaxed. They've got their comfortable surroundings. And it's more intimate because we're actually closer face to face through the device than we were in a room. So there are a lot of benefits if we're only able to open our minds to them. So embrace the challenge of finding new ways of working, new solutions. Even the fact that we're doing this now, this webinar, is something that might not have happened before. It might have been in the past that I'd go to a place, I've done that many, many times, delivered training, or I've attended training in person. And we used to think that was so much better. But I'm attending training now, training on how to deliver remote therapy, specific techniques that they said, well, it will never work remotely. But it's better in some ways because you can see the person who's the trainer very close. You can see what they're doing. You can have that closer connection with them. So there's benefits. Obviously, there's sometimes disadvantages as well. But life has suddenly become much more accessible to a lot of people. So let's embrace those differences. Let's embrace the challenge. Let's embrace the new technology and the new ways of working. Let's not assume that they're always going to be negative. They may turn out to be really positive as well, and lots of benefits from them. Somebody's asked me about the importance of keeping to a schedule or routine. Very important for a lot of people to stick to a routine and structure, especially when we might not have our normal structures in life. So it's really, really important for some people that you emulate the work environment. Get up at a certain time, go to work, make sure that you try and go to a different space in your house to do that work if you're working remotely. One really cute technique that I always advise a lot of people, and I try and do myself, is to copy or emulate the commute. So a lot of people have lost that commute, which is brilliant. A lot of people love that, who likes being stuck in traffic or squashed up on public transport, especially now. But that commute did form a transition from one zone to another, and we've lost that transitional time. So when we were on the commute, we could move out of work mode and move into home mode, and the other way around. So we've lost that, but we can gain it again. And it sounds really odd, but before you go to your desk in the morning at 9 o'clock in the morning or whatever, go for a little walk around your neighbourhood. Now that we can go out more than once a day, you can do this. And that can emulate the commute that we used to have. Obviously, if you have used to have an hour commute, you might not want to do an hour in the morning and an hour in the evening, but it's definitely worth having that separation between the work and the home with some physical separation. And that again addresses the issue of Zoom fatigue and internet fatigue that somebody raised before. Having those breaks and those transitions is really important. One of the things that we've really lost is that transition, as I say, from one, not just from work to home, but from one meeting to another. It used to be that we'd go from a meeting to training to an event, and we'd have that transition in getting there. Now we just switch buttons and we suddenly have to get our mind from one arena to another. So making sure you have a proper separation, a few minutes between each event, each meeting. If you can get outside and breathe the fresh air between that, that's really helpful too as well. So exercising is really important, and that's why we've been allowed to do it during lockdown, because it's really good for physical and mental health. Personally, I love getting outside and enjoying nature, as I've said. Eating healthily is a really positive thing that we can do, but we can enjoy the odd treat. I know a lot of people are perhaps indulging a little bit too much, but certainly the odd treat and the odd drink isn't going to harm us. Let's not take that to excess, because that will make us feel less positive and will be less helpful to ourselves. So as we're coming towards this at the end of this webinar, just to recap, managing your anxieties, challenging your beliefs about anxiety, focusing on those anxieties that you can do something about, managing the uncertainty around those anxieties that you can't do something about, staying positive, particularly making sure that you have appropriate transitions between different elements of your life, given that they're all so very similar with each other. And if we adopt these measures, they will help take us through these challenging times. They're still going to be challenging, and let's remember that. Let's manage our expectations. There will be times when things are overwhelming. There will be times when we're overwhelmed with change, technology, information overload. But that's okay too. Let's be kind to ourselves and be kind to other people. We are only human, and we're coping with a lot of change and a lot of uncertainty and a lot of anxiety, all in a very short space of time, with no real prospect of that changing in the very near future. So let's be kind and understanding to ourselves. So as we come to the end, I want to thank you so much for listening. If you feel that you or any of your staff need mental health support services during this difficult time, you can make a referral to Sparta Health on their website. And that website will be available to you on the chat pod or will be emailed to you. So from all of us at Sparta Health, I'd like to thank you very much for listening and for watching, and stay safe.